Today we have Dr. Deanna Mosley-Lawrence for our Q&A with the veterinarian. Dr. Lawrence attended NC State University and pursued her bachelor's in animal science, followed by her doctorate in veterinary medicine. In 2009, she opened Hope Animal Hospital, and soon after she created Hope's Chest, Inc. And do you want to say a little about what they do?
We are a nonprofit that we kind of have a special niche in the world of nonprofits in that we actually are a medical fund for hurt and injured animals that come into our local animal control. And so what we do is we provide medical care for animals that don't have anybody to actually provide that care for them.
Today's video is on feline leukemia. So, what is feline leukemia?
The feline leukemia virus itself is what is called a retrovirus, and it only infects the cat family. So you don't have to worry about your dogs or your humans actually getting it. It's not a very stable virus, so if a cat has leukemia, it can be killed very easily with disinfectants.
How is it transmitted, and are there any ways to prevent it?
Yeah, so transmission is actually through any close or social contact. So cats are very social creatures. So they lick and groom each other, and they share food bowls and that type of thing. So unfortunately, feline leukemia is spread through any body secretion. The most common secretion, of course, that we think about is saliva, but it can actually be found in the blood, the urine, the feces, any type of contact. So when you have multiple cats in a home and you bring in this little stray kitten, if they're sharing the litter box, if they're sharing feed bowls, if they're just laying together and cleaning each other, that's exposure. How can it be prevented? Well, there's actually again, vaccination is always very important. There is a feline leukemia vaccine that actually will prevent your cat from being susceptible to actually contracting the virus itself. There is a test that I can actually run in-house at the hospital. It's what's called a feline leukemia ELISA test. And so it's a snap test that actually takes only 10 minutes to run. So with just a few drops of blood, I can actually know that day that whether or not your cat is positive for feline leukemia. Because kittens, their immune system's so weak, they're probably one of the most susceptible ages for feline leukemia. So what we usually do for them is we do two vaccines for their kitten series, and then they need definitely a booster in a year to be protected. Outdoor cats are also higher at risk because they're exposed to stray cats. If you've got a population or a large population of cats and they're all sharing same, areas of eating, there's exposure there. So if your cat's outside, cats tend to wander, and so they'll usually meet up with other cats in the neighborhood or in the area, and that's where they end up being at higher risk for it. So I always recommend to anybody, if you're going to bring home a cat and you have cats at home, do not let that new cat come in contact with your cats until you have had it tested and seen by a veterinarian. I also recommend that you don't let them around your other cats for at least 10 to 14 days because there's so many other types of infectious diseases that animals can transmit to each other that in order to protect your cats, you need to make sure that the cat that you're bringing in is a healthy cat.
So if my cat gets feline leukemia, are there any symptoms that I can see?
So the typical symptoms, this is where I'm going to get all scientific. So again, there are actually 4 stages that feline leukemia can show itself. 3 of them, the test is actually negative that I run in-house. So I'm going to kind of go over those 3 first. The first one is called the abortive infection. And so basically this is a cat that has been exposed, but this kind of cat actually has the ability to fight off the virus. And so even after exposure, they defeat it because their immune system's strong enough. So they actually wipe it out of their system, never have any issues. That cat's feline leukemia negative, even with the exposure. Then you have what's called a regressive infection. This one, the body's immune system is strong enough, but not quite. So it's hard for the virus itself to replicate, but it does infect a few cells. So even though the cat has been exposed and there are some cells that have been infected, the cat never shows signs of symptoms. Hopefully what will happen is that the cat will actually fight the virus and eventually rid the body of the virus so that the immune system can actually get rid of it on its own. So the virus is actually just in cells, it's actually not in the blood. So that kind of cat would also be feline leukemia negative. Then you have what's called a latent infection, and this is where it's more than just a few cells, there's more cells that have actually been infected. But the term latent means it's just sitting there waiting. And so what will happen is that the cat, like let's say a cat's running out loose with some strays, it gets in contact with another cat for a year, 2 years, 3 years pass, it's got a latent infection, so the virus is just sitting in the tissue, just waiting. And then all of a sudden one day, boom, you have this kitty cat that comes in that's just chronically, are starting to have illnesses and different problems. And even though I tested the cat 2 or 3 years ago and it was negative, then I retest and it's positive. And it's because this virus has just been sitting there until it finally breaks with signs. So even though I have a cat that comes in that's leukemia negative, if down the road I start seeing symptoms, I retest, because it's very possible that it'll show itself later. And then you have what's called the progressive infection. And that's the one where the cat gets bitten, it progresses, and it turns into a feline leukemia positive cat. These cats, the material or the virus is actually in the bloodstream. So once it's in the bloodstream, that's when the in-house testing that I do will show itself as being positive. So that's a cat that's what's called viremic. The blood actually is carrying the virus at this point. And so this kind of kitty cat, unfortunately, once I have a feline leukemia positive test for this, they are actively shedding the virus. They are going to be terminally ill. Most cats usually don't make it more than 2 to 3 years. They usually pass within the next 2 to 3 years. And it's because the immune system just can't fight anything off at that point. The hardest part with feline leukemia is it weakens them so much that it's just a horrible death. I mean, they have so many chronic problems. There's so many different possibilities. They can have chronic abscesses, chronic infections in the mouth. It could be cancer. I'll have cats that'll develop lymphoma, but they're just any type of symptom possible, they're showing it, but they never respond. They just never seem to get over the illness, and those are the ones that we end up that pass away.
So there aren't any treatment options or anything like that?
Supportive care.
Supportive care?
Yeah. So a lot of times, like if an animal comes in and we find that it has leukemia and the owner, wants to do whatever they can to try to help the cat, we can treat with antibiotics and they'll get over, hopefully, maybe for a little while, but it'll just keep coming back. So we just try to do everything we can to make them comfortable. That's pretty much the most important thing. It's just comfort. And then once they're not comfortable anymore, it's time to let them go.
And that's the video on feline leukemia.